السماء والقلب بات يهتف لك بالصلاة. أحسن الناس سيد ومصطفى، خير الورى صلى عليك الرحمن. فيك الجمال والأمانة والوفاء، عطر قد فاح نور عمر في الآفاق. اللهم صل وسلم وبارك على سيدنا محمد. سلام عليك يا حبيبي يا رسول الله، سلام عليك يا حبيبي يا نبي الله، سلام عليك يا حبيبي يا رسول الله، سلام عليك يا حبيبي يا نبي الله، سلام عليك يا حبيبي يا رسول الله، سلام عليك يا حبيبي يا نبي الله، سلام عليك يا حبيبي يا رسول الله، سلام عليك يا حبيبي يا نبي الله. سلام عليك يا حبيبي يا رسول الله، سلام عليك يا حبيبي يا نبي الله، سلام عليك يا حبيبي يا رسول الله. جئت لنا خاتما للمرسلين، بدر الدجى رحمة للعالمين. أبا الزهراء كم أشتاق لنلتقيه.
FM. I'm Shabnam Ismail on the Pmb Pulse show, capturing the heartbeat of the community. Today, we are talking about something that affects us all, our reproductive health. And joining me is Dr. Mama Petra. Welcome, Dr. Petra.
Thank you, Shabnam. Thanks for having me.
Dr. Petra is a specialist gynecologist based in Hilton in Pittsburgh, and she focuses on the hormonal gap, which are the various unspoken transitions women face in perimenopause, postpartum, and with over a decade of clinical experiences, she is dedicated to ensuring women feel seen, heard, and respected in their healthcare journey. Her approach blends evidence-based medicine with intimacy, aesthetic wellness, and emotional healing. Through her private practice, online programs, and patient-led community, Dr. Petra helps women reclaim their journey, confidence, and connection, especially when they've been told just to wait it out. So her signature approach bridges the space between hormones and wholeness, because every woman deserves to feel like herself again. Wow, a gynecologist with so many expertise. So once again, listeners, from menstruational health to menopause and everything in between, we're going to get real, get honest, and get informed. So Dr. Petra, let's dive straight in. I'm very excited to actually interview you today, and hopefully we can insight and tips to our women out there. So tell us, what are some of the common signs of hormonal imbalance in women? How can they impact confidence?
So I think before we do that, I need people to understand what hormones are, because I feel that sometimes in society we say things like, you are acting hormonal, I feel hormonal, almost like hormones are a bad thing. And hormones are actually, if you imagine someone having a phone call, your cell phone, a communicator, that's how we should see our hormones in our bodies. They're actually communicating messages in our bodies where most of it starts in the brain, and your brain will say, I need more energy, for example. And then we'll activate a hormone that says, give more energy. And perhaps
Mm,
those hormones will then go to the muscles and tell them to start doing what they need to do. So if we see our hormones as messengers in our bodies,
mm,
then we have a better understanding that it's not something that is bad. But if the hormones then start to not do what they're supposed to be doing, if they are being sent to increase energy, but in fact cause you to have less energy, then that is a problem. And that's what we call hormonal imbalances,
mm.
when the hormones are not doing what they should be doing. So there's so many different hormones that are relevant to women. And I think I won't tell you all of them, but hormones such as estrogen, progesterone, testosterone, thyroid function, and insulin are, and I would also say cortisol, are probably six of the most important hormones that I think every woman should know exists. So when we look at the different signs of hormonal imbalances, sometimes it's very subtle and not very, very obvious. So it's things like feeling just not yourself, vague, tired, more tired than usual, irritable, you're not sleeping well. You may find that your menstrual cycle is out of whack. Your weight, you may struggle to lose weight, or you find that you're gaining weight even though you've always been doing what you've been doing. Suddenly something has changed. And a lot of it also has to do with your mood, how you feel, how you interact with other people. For some people, it's about your brain and your function. So what I want to say is that your hormones affect every single cell and every single organ in your body. And if there is something wrong with it, then you will feel those symptoms in the different parts of your body.
Doc, I know in your profession you see thousands of women, and how does society pressure affect women's self perception and their body image?
So I would say that when it comes to women in society, there's so much pressure that we put on ourselves and society puts on us. But I think the biggest one is our appearance and how we present ourselves to people. So the typical, I'd say stereotypical view of a woman is that you must be beautiful at all times, always be presentable, you must look fit and thing together.
Mm.
And that puts a lot of pressure on women to be thin, to bounce back. You get women who then feel forced to do things that they usually do, such as having eating disorders to remain thin, taking all kinds of concoctions, safe or unsafe, to make sure that their bodies are looking a certain way. They take all kinds of creams, skin lightening creams, and different medications to help hair growth, and often suffer the side effects of that. So I think for me, it's time that women claim what they want them as, and also for us to just change the way we expect everybody to see us. I think also for women, we are probably each other's worst. In all honesty, when you're wearing those beautiful shoes, I don't know if you're wearing it for anybody but other women to see. So I think it also starts with us as women and just accepting that we are all very different. The way we look, our skin color, our shape, our size, and embracing that in within healthy parameters. I'll give you an example. So there is this, I would say, notion about how a woman must be thin and you must look slim.
Mm.
But then there's also this pushback that we must accept how we look, and that if you're fully figured, that you must enjoy and embrace it. Now, the disconnect comes with the two because if you're curvaceous, that is amazing, and we all have our different shapes, but it must be within healthy limits.
Correct.
So if you're looking, for example, at a woman, she may have, I would say, she may be well endowed in the bottom area and maybe smaller in the top area. And what you would want is a waist circumference that's less than 88 centimeters. So even if a woman is very curvaceous and we embrace the voluptuous shape of that woman, that it's still within a healthy parameter from her health point of view.
That's really informative, doctor. And I know in your profession, you see women during different chapters of their lifetime, teenagers, going through marriage, delivering a baby. I'm sure you delivered quite a few babies in your career. And I think a topic for our ladies that's going through menopause, what advice would you give them?
So menopause has become a very interesting topic recently, and I'm sure to your listeners, many have heard about everything that's happening now with various podcasts and posts. We always joke that there are certain things that a woman will always go through irrespective. That's birth, death, and menopause. And in the past, there has been so much controversy about it. The view that menopause is an end of life, you've lost your beauty, lost your youth, and you're not so energetic. What it means is that you will no longer be able to have children because all your eggs are gone. And it's often been associated with a negative part or phase of your life. But what I wanted to say is that because women are living longer, about half of the life that we have is going to be spent in menopause. And for us to see it as something negative means that for the next half of our lives, we will be going through a terrible time. What I wanted to say is that now with new information and research and technology, that there is so many solutions for women when they go through perimenopause and menopause that helps them go through the transition. I think also it's important for us to differentiate between perimenopause and actual menopause. So perimenopause is a transition. It's a change in our hormones where the eggs that we had start to go down and you get ups and downs of your hormones. 1 month everything is fine, next month everything is low. And that's often the space where people struggle. What is interesting and what we found is that this perimenopause change can take up to 10 years before you actually get to menopause. And menopause is where you have no more eggs, you have no more hormones, and you no longer have your menstruation. So, if you're going to have your menopause at 45, that means that you can actually start your period age of 35. And if you do not get enough support from medication, from lifestyle changes, from hormone and support, that you can really struggle during this time.
Listeners, this is Dr. Petra, the expert with gynecology, and it's time we prioritize our well being and take control of our bodies. We're going to have a quick nasheed break, and we're going to tackle everything about women's health.
حبيبي يا نبي الله تزينت بك الأرض والسماء والقلب بات يهتف لك بالصلاة أحسن الناس سيد ومصطفى خير الورى صلى عليك الرحمن فيك الجمال والأمانة والوفاء عطر قد فاح نور عمر في الآفاق اللهم صل وسلم وبارك على سيدنا محمد سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله جئت لنا خاتما للمرسلين بدر الدجى رحمة للعالمين أبا الزهراء كم أشتاق لنلتقيه وأرى عينيك في الجنة تحت النخيل فيك الجمال والأمانة والوفاء عطر قد فاح نور عمر في الآفاق سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا
of the community. And today we're tackling a topic that's often stigmatized, super important, gynecological health. We often shy away from discussing these issues, but today we're breaking the silence. And joining me is the esteemed Dr. Pepra, specialist gynecologist in our city of choice, who's here to give us the lowdown on women's health. Welcome again, Dr. Petra, and it's great to have you on the show this Saturday.
Thank you.
Can you tell the listeners a little bit about the you are supporting women behind the scenes feel good about themselves through their journey of womanhood?
Yes, thank you for that. The Nurture Hub is a postpartum woman. Now, postpartum is when a woman has given birth and is trying to figure things out after she's had her baby. And sometimes it can take a really long time for people to adjust to the sleepless nights, the changes in their body, all the physical and hormonal things that they're going through. So I would say that Nurture Hub started after my own personal experience and difficulties in my postpartum. And I realized that there wasn't enough support for women. And the biggest thing for me was the community, the sense of knowing that you're not alone and meeting many different women who've all had very different experiences when it comes to giving birth, but being able to share it and know that the struggles that you've had are not on your own, and that it's not something that you have to be ashamed of. The other thing that really makes me excited is about mental health, especially after you've given birth. Women are very vulnerable and fragile during that time, not just because of the physical changes, but the demands of having to look after a newborn
Mm.
and the role and of everything that happens and all the expectations that come. So mental health, if there's one time a woman is most vulnerable to having mental health problems, even if you're a strong person and you have a good support system, it's in the postpartum. So we need that support as a community. Um, just to make sure that everyone is fine. And we need mothers that are flourishing because we are the ones who are raising our children.
Yes, Doctor, in my profession as well in the medical sector, I've touched base with so many women, and especially the mothers to be. I mean, they have so high expectations to meet. I mean, they're worried about delivering their first baby, lifestyle challenges. And do you also play a role with the dads and try and also get them involved in some of your projects at the Nurture Hub?
Yes. So I always laugh at the dads because I often feel that they've been dragged to the appointments when they would come and see me, or they get dragged to the courses. But your partner, and I'm speaking to the woman in this in your audience, if your partner does not have the information and the understanding of what is going on, they will make or break your postpartum experience.
Mm.
And if they are not on board with you, it can become a very difficult time. So I focus on dads a lot and help them navigate how they can support their partner and not just, be a bystander. Because if they do, they revolutionize how their partner will go through that transition. And it also helps them to connect and bond with their baby themselves. I think society is also changing now because in the past, fathers were not really involved, mothers would do most of the work. But now, because things have shifted slightly, fathers are becoming more involved and they want to be, but
Mm.
sometimes they don't know how.
Yes. I know quite a few of our topics we highlight mental health and wellness, and July is ultimately Mental Health Month. What's some of the tips you would highlight to help a female going through stress? Any suggestions that you'd like to share with our listeners?
Yes, there is quite a bit. I think the first thing is to break away from the stigma that mental health means that you're weak, that even if you have a strong mind, you're not that kind of person, that you are still at risk, no matter what happens, and specifically during changes. So I would say the first thing is to have self-awareness of what drains your energy, what things look like for you when you are stressed, and actually listen and honor your body when it is telling you that you are not okay. Often, before someone goes through a full mental health breakdown, there are signs that happen for months, for weeks, before they actually get to that
Hmm.
point. And if we are aware of what is happening in our bodies and give ourselves time to rest, to meet that we enjoy, it can often change the trajectory of where we're going with our mental health decline. I think the other thing is just to speak about it. Open, honest conversations. I think as women, we like to have this facade that everything is fine. We smile even though we are struggling inside. And one of the core passions for me is to just speak about the unspoken. Just say, "This is hard. I am struggling. Have you? What can out to women?" I think also with my profession, I meet a lot of women in the same space. Often they're in the same community, they can be in the same circle of friends. Me, their struggles. in a room, they don't share those struggles with each
Correct.
other. And I wish women would just talk. Because once we start that, we start to own the struggles that we're going through, and then we can start finding solutions for each other. But I think those are the most important things: decreasing the stigma, speaking about it and tapping into our community, and then listening to our bodies and honoring the fact that we need to rest and actually take care of ourselves.
I know Women's Month is coming up, and I know a lot of organizations are adopting projects to obviously educate women. And I hope that these are some of the tips they can incorporate into those workshops and events. And now, Doctor, can you tell me at your current practice, the woman goes through those chapters we spoke about. So, how can women prioritize their physical and emotional well being beyond reproductive health?
I think that's also something that's very important because people feel that they only need to go and see a doctor or health professional when they're pregnant or when they are sick. And the focus on my practice is prevention and wellness. So ensuring that you maintain where you are or at least improve your situation and optimize things in whichever way that you can. So I would say for women, the most important thing that you can do is prepare beforehand. So the issues that you have, you note them down. Often I think we become nervous or too embarrassed to talk about it. So if you prepare, write down your notes, the questions that you have. I think that's the first step. The second step is to pick, I would say, a healthcare professional that gels with you, that you feel listens to you and understands the problems that you're having. Because sometimes, if you find that you've seen somebody and they didn't fully understand or dismissed what you have said, they won't be able to help you. So, those are the two most important things for me.
And doctor, can you tell us, in terms of your profession as a gynecologist, modern technology, any new items on the market to help our women out there? What is trending at the moment?
Yes, so I would say, firstly, is I do a lot of intimate rejuvenation. Intimate rejuvenation are different treatments that help boost your body's natural ability to heal. So, for example, when a woman has given birth and her body has changed, we have treatments such as PRP, collagen boosting treatments, hyaluronic acid, all these amazing factors that can help amplify a woman's healing. So there are some shots that women can receive. There's some laser treatment that help with intimate rejuvenation and tightness, which will help improve their intimate life and confidence and satisfaction. There's also many solutions we can do for the body. It's very important for people to have the foundation of exercise and lifestyle, but sometimes things like, for example, you've given birth and you may feel that there's some looseness of your stomach area. There are solutions where we can help with tightening and helping you to feel more confident with how you were. Things like stretch marks, which is also something that happens with changes in weight, having children. There are solutions to decrease those kind of things. So I think we are living in an era now, modern technology, where the things that you used to find embarrassing and you feel, oh, I must just get on with it, that there's solutions. Things like pigmentation. Before, people are scared to use things like bleaching agent, but we have new technology that does not strip the skin and brighten the skin. If you have issues with, I would say, dryness of your face or breakouts with acne, there are solutions for that as well. So there's so much out there. Women do not have to suffer alone anymore and just accept that things are the way they are. There's so many things that can optimize their state.
Fantastic, Dr. Pepra. Listeners, today we are talking about something that affects us all, health. And Dr. Pepra is here to make you feel good, feel brand new. And we're going to connect with you shortly and unpack more information and education regarding reproductive health. We're going to take a quick ad break and connect with you shortly.
العالمين أبا الزهراء كم أشتاق لنلتقيه وأرى عينيك في الجنة تحت النخيل فيك الجمال والأمانة والوفاء عطر قد فاح نور عمر في الآفاق سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي
From the
الله
Pulse,
سلام
touching the
عليك
heartbeat
يا
of the community.
حبيبي
You're
يا
listening to our
رسول
station on
الله
90.2 and
سلام
105.3
عليك يا
FM. And today we
حبيبي
are
يا
prioritizing the
نبي
womanhood, the
الله
well-being, and taking
سلام
control of our
عليك
bodies
يا
with a
حبيبي
very
يا رسول
us
الله
who is a
سلام
specialist
عليك يا
gynecologist, and
حبيبي
we are discussing issues, breaking the silence, and we'd like to support you and make you feel brand new. Welcome again to the show, Dr. Pepra. Pepra, can you actually elaborate about polycystic ovaries? Because obviously that seems to be quite a challenge for also our women going through their teenage years, and they get diagnosed, they get married, they have challenges with infertility. Could you highlight some of the advances in medicine or therapy that they could utilize to obviously walk that chapter?
That's a very interesting topic and a very huge one. I think polycystic ovarian syndrome is something that is not well understood. We call it PCOS or PCOS. And it's something that is still undergoing a lot of research. But essentially, polycystic ovarian syndrome happens, and we make the diagnosis with there's three certain criteria that we look at. If you have at least two of those criteria, it implies that you have polycystic ovarian syndrome. The first one is having high testosterone levels. So that is shown usually if somebody struggles with their skin, so they have acne, they have a lot of hair growth, having to go get your hair removed every week. But specifically the mustache, in the beard area, around the chest and the breast area as well. So these are women who are struggling with excess hair growth. The Some women don't have that, and this may be seen just on a blood test. The next thing that we look at is issues with your menstruation. So, if you are skipping your periods are irregular, you never know when your menstruation is going to happen, that may indicate that you have polycystic ovarian syndrome. Another one is infertility and struggling to conceive. So, many people for years will feel that it is normal. But if you are struggling to conceive and it's been more than 1 or 2 years of you actively trying, that may imply that there is a problem with polycystic ovaries. And then the final one is on an ultrasound scan. So when we do an ultrasound scan, you can actually see the cysts on an ultrasound scan. So that's actually where the term polycystic comes from, because you see many cysts, tiny little cysts on your ovaries on an ultrasound scan. The other way we can do it is also with a blood test, which we call AMH. And if that is elevated, then it suggests that you may have polycystic ovarian syndrome. So if you are a woman and you have two of the three main um, parts that I've mentioned, come and speak to your doctor, because it may imply that you have polycystic ovarian syndrome.
Yes, doctor. And we spoke so much earlier about the different chapters with womanhood, and we focused on stress. I think society is such that, the self care is so important. And, in terms of social media influence, women's self perception, and body image, what are some of the tips you will give women?
So I would say first that social media highlights the highs, the good parts of life, and that it's not realistic. And if we keep spending hours scrolling through and comparing what we see on social media with our lives, we will have a very twisted view of what the reality is. Things like how people's bodies look, their lips and faces, and what beauty really looks like. It really is an unrealistic thing. The next thing I would say is that self care for every woman is different. So, one woman may find self care as having a massage, getting her nails done, but that's not self-care for every woman. Some women enjoy going for walks, some people enjoy exercising, some people enjoy just spending time with themselves or listening to music. So I think, and I'll go back to the fact that you need to understand more about yourself as a human being, and that when you self-replenish, whatever that looks like for you, it doesn't have to be the same for everybody else. So I think we need to just move away from the culture of comparing ourselves to other people, understanding that we are who we are. There's nobody else like us in this planet. Nobody has had the same life we have had, and we need to honor that.
That's so important, doctor, because, obviously, fundamentally, in my profession, I speak to women all the time. And, women do play significant role mothers. They're working as well. And they obviously have busy schedules. And quite a few of my colleagues who's tried to conceive, come back to say, I have such a stressful life. I've got child are listening to this amazing topic, make time for you. Take some time up for yourself so that you're not going to be having these challenges and living stressful life. Question as well is urinary tract infections. And for a woman out there, what suggestions you would obviously make in lieu of prevention?
So I would say, firstly, with a urinary tract infection is an infection in your bladder, and I think people often confuse a urinary tract infection, which is a UTI, with what we call an STI, which is a sexually transmitted infection. I think that's one thing. So urinary tract infection is an infection that you get in your bladder, and it typically happens when bugs around your intimate area manage to go into your bladder, which is supposed to be a sterile area. So I would say for women, when those kind of things happen, we need to look at what has compromised the barrier that has caused me to have this infection. So this is why we advise things like when you go to the bathroom, you wipe from front to back and not back to front, because that introduces bacteria that should not go to the front in the front. Sometimes it can be caused by irritation, and sometimes it can actually be caused by hormonal changes in your body. So you'd find if a woman is pregnant, she is more prone to having a urinary tract infection. In menopause, you get physical changes to your intimate area that make you more vulnerable to getting infections. And this is different from an STI, which is transmitted from somebody else. So someone will give it to you during a time of intimacy. That is very different, and that comes with challenges such as discharge, significant pain in your stomach, and perhaps a fever. So I think it's important for people to be able to differentiate the two. What I will say about STIs is that often women will feel that they have an STI if they have a discharge, but there are different types of discharge, and it's important to know which one is normal and which one is not. So, with a discharge that is not normal, the color will probably be green or yellow, and you will have other things associated with itching, discomfort, maybe some changes of how your intimate area looks like. Whereas a normal discharge, which is normal for a woman, will be clear, will have no odor, and won't bother you, and you'll find that it will change as you go through your cycle.
And Dr. do you work closely with psychologists and obviously refer some of your patients to them depending on if they've had a miscarriage, they're trying to conceive again, and you've done your bit and they need further assistance?
Personally, I think every woman needs a psychologist at some point in their life because we are all going to go through a transition of some sort. Our mental health, as I'm saying, we are more vulnerable compared to men. That is the fact, that is research all over the world, no matter who you are. So I have very close relationships with a variety of different psychologists in the KZN Midlands and Pietermaritzburg area who have a specific passion for women's health because that's also different. If you see somebody who is not specifically focused for women, they may not understand the nuances of what happens for women compared to men or teenagers or children. So I would recommend that you see somebody who has a specific interest and specific experience specifically when it comes to women's health. So often I will refer women going through postpartum struggles, polycystic ovarian syndrome struggles, intimacy issues with their partner. So many people, so many women will come with me with a medical problem. But as we go deeper, we find that there are issues in their relationship with their intimate health and life and confidence. And you realize that as a gynae that I won't and address all of them. So having many people in the team to support women, such as psychologists, such as pelvic floor physiotherapists, such as skincare, those are so important when we look at women's health in total. That's what we call holistic health. Understanding that not one health professional is going to be able to help you with everything, and understanding that wellness is a journey and it's a lifelong journey.
I totally agree with you, Dr. It is a journey, and I think every woman needs to take a step back, start a journal, see that she is making time for self care, giving time to herself. And one question that I to understand, and the listeners would probably like to know as well, is there's so many products out there in the market, and obviously you're listening to a friend, you obviously see something good, you feel good. There's also risk involved, as you spoke about earlier. Do you normally refer to a GP, or is there something you recommend in terms of nourishment or nutrition or any supplements? What would be your thoughts around that?
Okay, so if you're looking at the foundations of women's health, I think number one would be finding somebody who is knowledgeable and passionate about the wellness of women. So, a medical doctor with that interest, if it's a GP, some people will choose to go to somebody, for example, a naturopath or homeopath who has had specific training. I would say, have the healthcare that is aligned to your values and what you believe, and also have a healthcare professional who makes you feel empowered. Now, if you're looking at supplements, I would say that there's specific evidence that women should be using certain treatments, specifically women over the age of 35. When we look at things like bone health and muscle health and longevity, meaning that you age well and are strong and healthy in your 80s, the basic foundations is for women to improve their bone health and their muscle health. Now, the muscles has been found to be an organ that helps boost longevity. And as women, I know we want to be thin. So we don't actually, we have this perception that having muscle makes you look like a man. But muscle is actually the one hormone that helps with, the one organ that helps with hormone imbalances. It helps with polycystic ovarian syndrome. It helps you with your postpartum transition and with your menopause journey. And if we focus on building protein and supporting our muscle and bone health, I think that's one very important thing that women can do to help them through the transitions and improve their health and wellness when they are older. So evidence is suggesting that women had to have optimal levels of vitamin D3. So that's either through your lifestyle or through supplements. Omega 3 helps with brain health, and so that's with fish oil, having salmon and oil-based fish intake that we have. And if you can't have that, you have the omega 3 supplement. Those are important things. Boosting your protein, a woman should be having at least 30 grams of protein with every meal that they have. I don't know how many women will wake up and skip breakfast because they're fasting with intermittent fasting and want to be thin. So we need to support our muscle health. So I would say if there's one thing that women need to focus on in this day and age is supporting their muscle and bone health by exercising, by doing weight bearing exercises, by not trying to be thin, but trying to build bodies that are strong so that when we go through our life cycle and our life journeys, that we are fit enough to be able to age well and eventually grow old in a healthy way.
Dr. Peprov, you shared such vital information, and I hope the listeners are taking heed and note to make a change in your life. What would be your final message to our listeners, and how can they get in touch with you?
Okay, so my final message would be health is changing and that we need to move from the attitude of treating ourselves only when we are sick and shifting to more of prevention. That there are many things that we can do to prevent ourselves getting diabetes, getting hypertension, getting so many medical and health conditions that people are taking chronic treatment for. And as women, that because we have this information, our destiny does not have to be the way our mothers have been. That if my mother had diabetes, it doesn't mean I have to get diabetes too. And if my mother had osteoporosis and fractured her hip, I don't have to get osteoporosis too. There's much that we can do if I focus on my health now. If we do that, that will decrease the chances of those chronic conditions. Number two is that I want to say is that we no longer have to be silent about our health. We no longer have to be afraid or embarrassed when things are not okay, that we need to speak up. The third thing I would say is that we need to tap into our community and support and just speak to women, be unapologetic and have real conversations about it. I would say those would be the three take-home messages.
That's very important, doctor. And you know, as women having daughters, what you put in, you get out. So nourish yourselves, remain healthy, eat right, make the right choices. Jazakallah khair to our listeners for tuning in today's show. It's been absolutely important and a fundamental topic regarding women's health. And I thank you, Dr. Pepper, for joining me this morning and sacrificing your precious time and for sharing your expertise, empowering our listeners such valuable insights. Until next time, stay informed, stay empowered, and take care of your health. From your host, I'm Shabnam Ismail from Pietermaritzburg, The Pulse Show. Closing on, we will see you Saturday, same time, same place. Assalamu alaikum wa rahmatullahi wa barakatuhu.
سب سپرد خدا کر دیا اس حسین ابن حیدر پہ لاکھوں سلام السلام السلام یا حسین السلام 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 یا حسین السلام 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 یا حسین السلام جس کا جنت سے جوڑا منگایا گیا جس کو دوش نبی پر بٹھایا گیا جس کے بھائی کو زہر پلایا گیا جس کو تیروں سے چھلنی کرایا گیا اس حسین ابن حیدر پہ لاکھوں سلام السلام السلام یا حسین السلام 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 یا حسین السلام 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 یا حسین السلام جب تلک جسم میں روح اپنی جونے ہم کریں گے وفا اپنا ہے فیصلہ ہو نگاہ کرم شاہ قلب و بلا السلام السلام یا حسین السلام 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 یا حسین السلام 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 یا حسین السلام حسین 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 دل برے مصطفیٰ 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 دل برے مصطفیٰ جانے بدر الدجا فخر شیر جلی ناز رب العلا لا الہ کی صدا تم پہ لاکھوں سلام السلام السلام یا حسین السلام 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 یا حسین السلام 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 یا حسین السلام دین حق کے لیے اپنا گھر ہے دیا جو نہ کر پائے کوئی وہ تم نے کیا دین حق کی بقا تم پہ لاکھوں سلام اے آخی یہ حسن اے امام تم نے پڑھا کوئی قرآن ایسا تو پڑھ نہ سکا. السلام السلام یا حسین السلام. السلام السلام یا حسین السلام. السلام السلام یا حسین السلام. جس نے حق کربلا میں ادا کر دیا اپنے نانا کا وعدہ وفا کر دیا. سب کچھ امت کی خاطر فدا کر دیا. گھر کا گھر سب سپرد خدا کر دیا. اس حسین ابن ہے